Hey guys, Nick Espinoza, your chief security fanatic here, and today we're actually going to be talking about Google, and I've got notes here from the Wall Street Journal, and I think this is absolutely going to surprise you. Google is engaged with one of the largest health providers in the United States, basically on a project to collect and analyze detailed personal health information on tens of millions of patients across 21 states in the USA. Now, here's what's going on. This initiative is codenamed Project Nightingale, and it appears to be the biggest healthcare project ever by Google, and it looks like it's designed to position them as the premier data handler for HIPAA or medical compliant data within the United States. Now, that is obviously a position that Google has been wanting for years, obviously going after government contracts as well. But this is not a government contract. Google is working with one of the largest health providers in the United States, Ascension Healthcare, out of St. Louis. This is a Catholic organization of more than 26 hospitals, doctors' offices, and other facilities, at least in 21 states, according to my notes here. Now, the data in question that is coming from Ascension, that Ascension is giving to Google, is lab results, diagnoses, hospitalization records, and complete health histories, including patients' names and dates of birth. Now, here's the thing about this. Neither the patients of Ascension Health or the doctors of Ascension Health were actually notified that Google has been doing this. Again, this is according to the Wall Street Journal and their sources. At least 150 Google employees already have access to tens of millions of patient records, again, according to the Wall Street Journal. Sources told the Wall Street Journal that some Ascension employees internally have raised questions about the way the data is being collected and shared, both from a technological and ethical standpoint. Now, here's the thing. In the United States, we have HIPAA. This is our core law that basically protects patient data, and this is actually permissible in some ways under HIPAA. Now, a medical provider like Ascension can share HIPAA-compliant data or medical-compliant data with its business partners, providing the information is used, and I quote, HIPAA, only to help the covered entity carry out its healthcare functions. But is Google really helping Ascension here? And that's one of the questions that we have to ask. They're saying that they're using this information to design new software for Ascension, obviously backed by an artificial intelligence to make more intelligent choices, let's say, for patient healthcare. But Google has a history of data mining, even when they say they're not. We've also, basically heard reports. I've done videos on this and audio. I believe I've also written on this, where Google has been letting their own third parties into the back end, into what we've considered private areas like Gmail, for example, and allowed them to data mine, read unredacted emails and all of that. Now, my assumption is that Google would be taking medical patient information or HIPAA compliant information and treating it with a little more sensitivity and care, but their track record really doesn't have that. And I don't necessarily begrudge Ascension from using Google, for this, but my biggest issue here is the transparency factor of this. If you've worked with HIPAA compliant entities before, you know that a lot of them have things like third-party billing and all of this, and they're not necessarily disclosing that up front to their patients. In other words, if a patient is walking into the hospital is not going to say, oh yes, by the way, we're outsourcing your patient billing to XYZ, that's who you're going to get a bill from. It usually is in the written HIPAA statement that you have to sign, that basically says you have a release to allow third parties. But when we are talking about an entity with the track record and history of Google, I think it really behooves Ascension to be a little bit more transparent with this, in the same way that we need Facebook and other massive data analyzers, data aggregators, and data miners in basically the entire world to be transparent with what they're doing with their data. I'm curious to see how this would translate for Google into Europe, where they have the GDPR. I'm also very curious to see how this will translate Google into California, the state of California, as they spin up their own GDPR-styled data privacy laws for California citizens. Is Ascension Health in California? I should really look that up and check that out, and I completely forgot to as I'm making this video, but that is your news of the day. And my question to you is, and I'd love to hear from all of you on this, is that if you are a member of Ascension Health, you do not have to admit that, but would you want your health provider, let's say Ascension or somebody else, to be giving your information willingly to Google without really letting you know? You're just simply signing that they will share with third parties, and that third party happens to be Google. Would you want to have much greater transparency and visibility into those third parties? And my answer, I think, would be yes. I would like to know exactly who that is, just so I can read a list. We've seen some major medical billers here basically cause HIPAA breaches in the last year that have caused tens of thousands of basically small practices and all of that to have to declare breaches. Google hopefully is a little more secure than that, but what Google does with the data isn't necessarily that. And so that is your news of the day. I'd love to hear from you. And please like, share, follow me here on Facebook and Twitter at NickAESP. And please feel free to subscribe to me at YouTube as well. And as always, stay safe and stay online. Thanks, guys.